The whole world is now zooming in on what they call UHC, Universal Health Coverage. And they have added a cliche, leaving no one behind. What does it mean to those of us in this country? I keep on telling them at the international fora, places that Ghana is invited to, that we started talking about universal health coverage the way they are talking now on the globe, as far back in the history of our country, not just now, but some time ago. The two main things they are talking about is financial risk protection, removing all barriers to access for everybody for healthcare. Then we are talking about concentrating efforts on what they call primary healthcare, because that seems to be very easy to achieve in every country. And I tell them that these things Ghana started so many years ago. Across the sub-Saharan Africa, apart from South Africa, no other country has successfully introduced health insurance the way we have it. And we started 2003. Again, Ethiopia came to learn primary healthcare issues from our country. But they have taken the lead ahead of us. And if someone will permit me to quote, they are in a comfortable lead when it comes to providing primary healthcare services. But definitely Ghana is not behind so much away from what other countries are doing with primary healthcare. Now we have deepened our efforts through the introduction of the chip compounds, and year in, year out, though investments wouldn't allow us to do so much, but we are moving gradually towards achieving what the world wants us to achieve. Universal health coverage means that access without barriers, without financial barriers, without geographical barriers, and demographic barriers, so that wherever you live in the country, what type of person you are, you should have access to health care. Then we talk about quality of the care that we receive. Again, government's efforts is that this should be equitably distributed across the country, so that wherever you are, services that are provided should have the same quality standards as somebody living in the major cities, where we seem to have a lot of concentration with healthcare facilities. Not only this, we're also talking about people having access to medicines that are not counterfeit, that are not fake drugs. And government is making all efforts through our regulators, with FDA leading, to make sure that we have what it takes to be called medicine in our country. We haven't succeeded yet, but Ghana is not the only country. Even in America, we still cite fake drugs. Close to us, it's even worse. And like you said, our porous borders doesn't even give us room to be so efficient that we cannot trace some of these on our markets. When we talk about primary health, universal health coverage, strategies, I've mentioned a few. Primary healthcare issues, health insurance issues, to do financial risk protection. But there are a few new things that we need to do. And that is why I was congratulating the JoyBusiness team. JoyBusiness. We need to do partnerships. And these partnerships should be innovative partnerships, not the traditional old things that we do. Government has been talking about partnering the private sector, but we still don't see massive private sector investments into areas where government will wish that these investments are there. Government will continue to play its traditional roles, basically providing infrastructure, putting in trained workforce, making sure we have adequate things in there to be able to do what we call quality care. No government will stop this, but we need to partner and hold hands with other stakeholders, and especially the private sector and development partners. We turn ourselves around and we are seeing innovative ways that private sector is trying to push itself into the health sector, and government is encouraging quite a number and a lot of them. In the sector of pharmaceuticals, government is continuously trying to support private individuals to invest and manufacture some of the medicines that we procure from outside in country, so that we can have access to cheaper and more efficient drugs that will help our healthcare provision. So this effort by JoyBusiness is one of those innovative partnerships that we think that will help our way forward to achieve universal health coverage. Like I said, government will continue to provide infrastructure, put in trained manpower, and continue to support our regulators. Government is the only institution that actually ensures that there is regulation in the health sector. So we have the agencies that regulate efficiency in terms of manpower and try to take out fake people who go in to pretend that they are what it takes to try to provide health services. We have agencies that regulate medicines, that regulates the sale of medicines and manufacturing of medicines. We have agencies that do a lot more to try to make sure that there is sanity within the health sector. All these things we do for the benefit of our citizens, including you and me. And I believe it is time, if you are talking about innovative partnerships, we partner ourselves as citizens that are receiving health care being provided either by government or the private sector or by quasi-government institutions. What do we do? Feedbacks are things that we need. When you go and you are being treated the way that you don't think you need to be treated that way, let us hear about some of these things. Some of us just go straight to the media, but in some instances, the minister might not be listening to a particular radio station that you are pouring out. Some of us will sit on the radios as presenters and we talk and talk and talk. But the question is that at that particular time that you are talking, a very good suggestion is the minister or a director in the ministry listening to your station. So some of these things should come to us officially. Either write to us, book an appointment with us, come and talk to us, so we will know what to do and how to tackle some of these challenges. These are things that we encourage the public to do for us. So we know where we are failing, we will know where our faults are, we will know where challenges are, and see how best we can tackle them. I believe within the next 2 days, we're going to see innovative ways of trying to provide healthcare, from technology to medicines to whatever. What I don't know yet is how many Kenyan entrepreneurs are on this exhibition and how many things we are bringing from outside to market for the benefit of people outside. When I say benefit of people outside, they manufacture, they bring them here, we buy them, and they take their money away. They won't put our young men and women who are unemployed in their factories out there. So it is time for us to begin to see how best we can also encourage people to manufacture, to give ourselves jobs, to consume what we ourselves are producing instead of always buying from outside. I don't think I want to continue to talk and talk and talk. I would like to end here. But I will take the singular honor to declare this exhibition officially opened. Thank you.